Here in the interior, daily cases have been dropping much slower compared to the rest of the province. I guess today, I believe interior cases made up 35% of the total province numbers. Do we know why this is the case, and where in the region in particular, and in what situations is this transmission continuing to occur?
Yeah, so that is something I've been talking with my colleagues in Interior Health about, and we've been working hard to try and figure it out. And really, it is not one thing. There are certain communities, and we can see that in the data on the dashboard, where rates are higher, but it's moving around. And it's clusters of cases that happen in smaller communities get transmission. The transmission comes under control. But really, the central Okanagan has been a bit of a hotspot for a while in different communities in that area. We know that Grand Forks had a cluster of cases and transmission in the school, etc. So it really is a little bit all over the place, which makes it's so important that we get immunization rates up in every community, and that we continue to pay attention to those measures that prevent transmission, making sure we get tested if we have any concerns at all, and public health is following up with people to try and stop those chains of transmission. We know what we need to do, but sometimes we get a little bit complacent, and particularly where in communities where immunization rates aren't that high yet, it can spread very quickly.
Nick, do you have a follow-up?
Just on the subject of vaccinations, are we seeing any particular vaccine hesitancy in any of the smaller communities up here in the Okanagan and wider interior? I've noticed on the dashboard that there's some communities where vaccination rates are hovering around the mid 50% for adults still.
Yeah, and we've been looking at that at different communities around the province. And yeah, there are some communities, and it's different in different places. There's very few people that are absolutely against immunization, and sometimes they're very vocal. But what we are finding is, as I said this before a few times, there's a number of reasons. One of them is confidence in the vaccine, and that is part of our making sure people have the information that they need, that they understand the safety profile, how well it works, all of those things that people want to know to make sure that they're making the right choice for them and their family. So we're spending a lot of time with different community leaders and making sure we have information in the right language that supports people and that they can get those questions answered. The other one is complacency, and this is certainly an issue in some communities where they have not had a whole lot of COVID-19, and they haven't been exposed to how challenging and terrifying and horrible this virus can be if it gets into a community and makes people really sick. So there is a level of complacency in some areas, and we need to combat that by bringing vaccine to people and making it easy for them to get it. And that's the third one. It's around convenience. And we do know that for some people it's a really big deal to actually register and then book an appointment, and you have to go somewhere. So that's why we're doing all of these new initiatives that the Minister was talking about, drive-through, bringing pop-up clinics to smaller communities, and there's some really great ones being done with the BC Automobile Association and moving around to different communities in the interior and also in the north, and we'll be doing more of that in many communities, making it easy for people to just get the vaccine.
Just want to encourage people at living in interior health. I think interior health, talking to the CEO Susan Brown and the team there, is making a very significant effort to do, especially focusing on first doses and raising first dose immunization. Because in general, second dose immunization is slightly higher in Northern Health than interior health, but that in some respects reflects first dose immunization. We want to raise that up, and we've seen real progress in communities such as Rutland and other communities where we saw lower rates now, where those rates are coming much more back to normal. We have to keep going in those efforts, but I really encourage people in the interior to go to the Interior Health website. That it is absolutely important to register and to book your vaccination. But for many people, there are opportunities to get vaccinated, particularly with first dose. Right now, there will be through this weekend, through next week. There is, as we mentioned, more Moderna vaccine being made available, and a significant portion of that is for first dose and providing access, easy access to people who need first doses. So if you live anywhere in BC, but particularly in interior health and northern health, this is the time to get vaccinated. And all of the things that come with it, it's really a gift to our lives. It makes us safer. It makes the ones we love safer. It makes our communities safer, and it's going to allow us, as we all know, to do things that we would otherwise not be able to do. So this is the time to get vaccinated, and I'm very thankful to all of the communities who are working with us across interior health to see that happens.